Or wait, oh no, that clock is,
5:45, yeah.
Yeah, we're right
I
at the right
always-
time.
I look at that, that's, maybe that's no dying time up on the wall.
About 3 minutes slow.
Hello? That's
No dying
I'll
time?
be on the clock this week.
no dying time. No, I look at the one up there on the wall and that one's good. We should just swap them. Okay, we will call to order the Winona County Public Health Meeting to order. Excuse me, just one second. Hold on. The squirrels are spinning here. Come up here.
Page 10.
Yes. Okay. All right. Approval of the June 11th, 2024 meeting minutes.
So, second.
Okay, I have a motion by Commissioner Meyer, second by Commissioner Olson to approve the meeting minutes. Any discussion? All those in favor say aye.
Aye.
Opposed, nay. The meeting minutes approved. Chairperson's report. Okay. We did have a shack meeting last week. I struggle a little bit with the state people. It seems like they're trying to establish an identity for public health. Public health is one of those things that we need and is there, but it's hard to put your finger on, this is public health, this is public health, and how it all ties to. And so the leadership of public health is trying to, I guess what I would say is trying to reinvent themselves. They don't have a brand. And part of it, then they're looking how they convince both federal legislators and state legislators to give them money to do the things they do. It's all based on the money and stuff. So we had a lot of discussion about that. Had an interesting speaker come from, he was actually from Washington DC, and then he was from Boston, and he was an East Coaster, and he had helped do a lot of work in the public health arena and had successes with some different states in getting more funding and more, I guess, in ways, I think public health is looking for respect. You know, they do a lot of work. We have all these neat diseases. Like, I don't know if everybody saw the updated diseases reporting. Blue-green algae. Then there's a lot of medical ones I can't pronounce, but it's infants less than 90 days, hard tick, relapse fever, rat bite fever, multi-system inflammation syndrome. And again, then there's a whole bunch of medical ones, SARS, that are diseases that are required reporting. And so, again, public health does a lot of things, and if they weren't there, we would not be in a good shape. But it's hard to tell legislators to allocate funds to something that they can't quite put their finger on. Am I saying that right? You're a public health people. Yeah. Well, and it's like, so if you go into a retail store, you see the swoosh. You know what that is. That's Nike, Nike. You go to a disaster, you see the Red Cross, the on uniform. But a public health, they do have that little, I think it's a nurse's hat symbol or something, but nobody knows what that is. I mean, so like I say, I think they're struggling for their identity and then the rightful amount of respect that they get for keeping the public healthy and such. So it's an ongoing battle. And then they had unfortunately I was not able to attend. They had an executive meeting, a Zoom meeting, and they got all these work groups, which are important. Environmental Health Continuous Improvement Board, Foundational Public Health Responsibility Work Group, Infectious Disease Continuous Improvement Board, Member Development Work Group, Performance Measurement Work Group, Public Health Emergency Preparedness Oversight. So those are kind of some real main groups that work on all kinds of different areas. And they're things that are there, like you guys know they're there, and they're important things to keep track of. And we don't want disease and everything. I always like the infectious disease. I think that's kind of cool. We don't want infectious disease, right? We don't want that. So it is interesting. One of the things at the shack meeting, though, is, as you well know, and so much of government is all grant based. Oh, you got to get this grant for this. You got to get this grant. And I just told them, no, I don't want the grant. I want the check. Just give us a check, population base or whatever you want to do, and we'll figure out locally what needs to be done. Because the Minneapolis, the Ramsey, St. Paul's have all kinds of different issues than the Winonas, or even, the far, far north, real remote, real rural areas. I think I always use this example up in northwest Minnesota, they have a foot clinic. And it's heavily, it's critical to that community. It's an aged committee. And I'm sorry, old people can't take care of their feet. And if you can't take care of your feet and you can't walk and move, it contributes to a lot of other health things. I'm getting some head shaking there, so I'm not talking out of line. It is critical. But I don't know that they have foot clinics in St. Paul or Ramsey County, Minneapolis. And everybody agreed, just cut out all this grant, applying, time work it takes, and then tracking. There's got to be a better way to do it. And the Commissioner of Health was there for a very short time. I didn't get to quiz her too much on, they were all hot and heavy on water. And I don't think water came up, the nitrates in the water. Everybody was, the whole world was like, we were going to perish in southeast Minnesota. And it's kind of there. I don't know if you, Ross, are you working on water, the nitrates in the water issue, or?
We're still waiting for the state.
Yeah, see, that's just it. Yeah, we're waiting for a higher level to tell us.
They're still gearing up.
Yeah. The water will be froze soon. They won't have to, we'll be in a world of hurt. And there'll be the last shack meeting at the end of the year. The one thing that's I find a little problematic in state government is all these department heads are, political appointees. Like the one lady said there, she's new. She got hired, halfway through the term. I may be gone in, 2 years. And they all come in with their agendas and their grandiose plans, and then they're gone. So I don't know. It's like we should hire and fire department heads instead of making them political appointees. I don't know. Do I get a consensus on that? I'll lobby for that. Pardon me? Yeah. It does make it very difficult, because as long as I've been in this job, I've gone through at least 4, if not 5 commissioners of health, and they all come in with their own agenda, their own what they're going to fix the world, and then they're gone. In 4 years or 8 years, they're gone and stuff. So it doesn't, it's not an easy task. All right, so I've ranted. I'm just eating up the clock time here, folks. Anybody else have anything public health? Oh, schools, are we getting a uptick in respiratory? Are a lot of kids out, Dwayne?
I don't know what the official numbers are. There was at the beginning, but it seems like it's decreased a little bit.
Okay, because I know
Hard to
that
tell what's flu, what's COVID, what's.
whooping cough, there was a big concern. Have we had any cases of whooping cough in Winona County?
Yes.
Okay, that's on an uptick. Now, can you get vaccinated for whooping, to deter whooping cough? Was that one of those things the kids got when they were little?
Your pertussis vaccine.
Okay. And is that for life, or?
Oh, you need a booster every once in a while.
Okay, so again, should we be advocating for something like that or not?
It isn't suggesting that at this moment any more than the.
Oh, I probably really should have you come up to, I apologize.
Hi, Emily Fulford from
Yeah.
Public Health. No, the state isn't advocating for any additional vaccinations, just to be keeping with the regularly scheduled recommendations.
Okay. Because I did have one of my grandsons, they diagnosed it as walking pneumonia. It wasn't whooping cough. But
I know that there was an outbreak of pneumonia in Lewiston Altura School District that was being looked at. There were quite a few kiddos out that the state epidemiologist is following right now.
Oh, okay. All right, in Lewiston. So what is it? Wash your hands?
Yes.
Cough into your sleeve?
Yes.
Or stay home?
Yes, stay home if you're sick. That's the biggest thing.
Okay, all right. Okay. All right, so no other health things we should be on the alert for? I think Commissioner Olson, you got the pollens under control?
Hope so.
Yeah. A lot of dust in the air. In fact, driving down I-90 yesterday, coming back from Owatonna, between the gravel service road and the harvest, it was like in a dust bowl. It just was, you couldn't see. You really couldn't see for a couple miles.
Harvesting,
Yeah, and it was kind of unique. All right. Any other, you got time? You got anything else? Ross, you got anything you want to tell us
We do have
about?
one consent
Yeah, is there
item.
going to be a
Yeah, we do.
presentation?
Yeah, I can just give you a brief update on the
consent item?
renewal of the
Please.
next 5-year maternal child health block grant.
Please.
So this is a new 5-year agreement that we just need consent on. With this grant, they have separated the follow-along program from the maternal child health block grant, and it's going to be combined with the early hearing and birth defect grant. So that we'll be bringing that back yet this fall, but they did separate it and approve some additional funding. So we're still waiting on those documents. So we'll be coming back here with that. So this is just the maternal child health block grant, which is pretty much some supplementary funding for where certain individuals fall through the other grants where we provide family home visiting services.
So did it require a new set of paperwork to go along with that when they separated it?
They kind of deleted a few things, but pretty much it's the standard state contract. So.
Okay. Okay, all right. Anybody have any questions?
I would move to approve item 4.1, approve the 2024 to 2029 Title V Maternal Child Block Grant.
Second.
Okay, we have a motion by Commissioner Meyer, seconded by Commissioner Olson to approve the Title 5 Maternal Child Block Grant. Any further questions? All those in favor say aye.
Aye.
Opposed, nay. Approved. Okay, all right.
Just a quick communication for you. We will be back in 2 weeks with we just received the local public health grant 5-year update contract renewal. So we just got that last Friday. So
So are some of these dollars increasing?
we haven't seen the number yet for 2025, but that's supposed to be coming here shortly.
Okay,
We were also notified that we have been approved for $109,000 in cannabis money to kind of, we're not clear on the duties yet or the terms, but we're supposed to be getting some information on probably mitigation or, some type of educational dollars to help with substance abuse or something along that line. So we're still waiting for those details.
Sure. And you'll come with some proposals for how to best use it?
Once they tell us what we can use it for, yeah.
that's pretty key. Yeah.
Yes.
well, that was quite a topic yesterday with county commissioners and administrators at our regional meeting. And I know there's still a lot of discussion as to the ordinances and how public health should be weighing in on any ordinances that we do. So I know staff is working on some things. And so I definitely want the public health to look at, what they're seeing and if it makes sense. A lot of people are using, the tobacco rules and regs as a guideline. And I know MCIT is working on something and public health is working on something, and and the governor's office task force seems to be very slow in responding. It's unfortunate, but it's what it is. Okay.
Thank you,
Thank you.
Russ.
Well, we can't do too much work on it because then the state might change the rules and then that would be all, in air. All right.
Motion to adjourn.
I'll second that motion.
We have a motion by Commissioner Olson, second by Commissioner Vagley to adjourn. All those in favor say aye.
Aye.
Opposed, nay. We're adjourned. Okay, so we got a couple minutes.
And he's promised a quick and efficient meeting, so. First on
Yeah,
board,
because the doors are locking automatically.
exactly.
Take note, Commissioner Ward.
At 10?
Okay.
Do they? You can't get in or out after, we're locked in at 10?
You can't get in. So first item on the agenda is public comment. If anyone present or online would like to address the county board, please come forward, state your name and your address, and you would have 2 minutes to make a comment. I'll invite people 2 more times. Is there anyone present or online that would like to address the county board during the public comment session? One last time, anyone online, if you're at home, just unmute yourself and let us know. Hearing none, I'll close the public comment section. The next item on the agenda is 5.1 and 5.2 to approve county board minutes from October 8th and also the closed session from October 8th as well.
Move to approve
I'll
5.1
second.
and 5.2.
Motion by Commissioner Ward, seconded by Commissioner Meyer to approve items 5.1 and 5.2. Any other discussion? All in favor, say aye.
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 Opposed? Motion carries. Next item, number 6.1 and 6.2, to acknowledge the receipt of the Parks and Environmental Advisory Committee minutes and the Health and Human Services Advisory Committee minutes.
I will move to approve.
Second.
Motion by Commissioner Meyer, seconded by Commissioner Olson. Any other discussion? All in favor, say aye.
Aye.
Opposed? Motion carries. Next, consent comments and approval of the agenda. Commissioner Ward,
An update from the AMC meeting.
Commissioner Olson,
Nothing for me.
Commissioner Meyer,
Nothing.
Mr. Elliott. Anything you want to add? County Attorney Sano? All right.
I would have moved to approve the agenda with the slight modifications, adding comments at the end.
Adding, it was original, it's now,
A comment from Commissioner Ward and an announcement from
Second.
County Attorney.
So motion by Commissioner Meyer, seconded by Commissioner Olson to approve the agenda. Any other discussion?
Just so anybody in the public, the agenda was amended, was it today? We have 9.3 to put 2 county commissioners on the canvas board. So it was an amended agenda. That's what we're approving.
Yep, thank you. Any other? All's in favor, say aye.
Aye.
Opposed? Motion carries. Mr. Elliott, can you read the consent items into the record, please?
Yes, item 8.1, approve LG 220 gambling application for exempt permit, Pheasants Forever Winona Root River Chapter 242. Item 8.2, approve the 2024 through 2029 Title V Maternal Child Health Grant. Item 8.3, approve Minnesota Department of Human Services grant contract for children's mental health screening. Item 8.4, approve renewal of purchase of service and business associate agreements with Hannah Suzuki, independent agent. Item 8.5, approve agreement for 2025-2026 Adult and Children's Mobile Crisis Grant Cooperative. Item 8.6, approve fiscal year 25 septic treatment systems grant agreement. 8.7, approve 2025 Towards Zero Deaths Enforcement Grant Agreement and Resolution. Item 8.8, approve 2025 NHTCA DWI Traffic Safety Officer Grant Agreement. Item 8.9, approve resolution for donations received July 1st, 2024 through September 30th, 2024. And item 8.10, confirm payment of disbursements.
Thank you.
I'll move to approve the consent business as it was read.
Second.
Motion by Commissioner Meyer, seconded by Commissioner Olson. Any other discussion? All in favor, say aye.
Aye.
Opposed? Motion carries. That moves us on to item 9.1, receive SEMCAC presentation. Good evening and welcome.
Good evening, County Commissioners and Ms. Sonneman and Mr. Elliott. My name is Jen Hengel. I'm the Executive Director at SEMCAC, and I've been in my position since mid-November of last year when the board appointed me to this role. And it was a goal of mine to get to all the county boards within my first year, so I'm happy to say that after tonight I'll have reached that. So a little ironic because I spent most of my life in Winona County, so but I saved you for last. So yes, there you go. I do have a copy of our most recent annual report that was not included in the packet, so if I could hand those out. And I do have additional copies here too for others in attendance if they'd like to look at that. I'm here this evening to give you just an update on SEMCAC's programs and services, what we offer. I know that the 4 commissioners here have all served on our board at different times, and Commissioner Olson is on our board now. So if he brings items back to the board, that you have some idea of some of our programs and services and what we're doing right now. We are a nonprofit 501c3 charitable organization. We're going on 58 years in existence. We started community action agencies like SEMCAC started in 1964, actually, with the Economic Opportunity Act, and we started 2 years after that. So it really started with a group of citizens from Winona, Fillmore, and Houston counties, and it's grown, and now we're the designated community action agency for 7 counties in southeast Minnesota. We also have some services in Goodhue, Rice, Wabasha, Olmsted, and Waseca counties as well, in partnership with those community action agencies. On our board of directors, we have a third are public officials, a third are private representatives, and a third are consumers of our programs. So we're unique in that way that we really try to get the voice of various people on our board and people with lived experience as well. We have a staff of about 230 full-time and part-time people within covering those 11 counties. In addition, just hundreds of volunteers that serve our different programs too, with our food shelves and Meals on Wheels deliveries and volunteer drivers in all of our programs. But just have a really wide reach across southeast Minnesota. And the annual report kind of sums up all of our programs and all of our services throughout our service area, but we also included in your packet this evening just the impact report for Winona County in particular. So I wanted to just go over some of those highlights as well.
Jen, I'm sorry, could I?
Yeah, of course.
Apologize. Heidi, if you're able to, could you call up it's page 107, I believe, SEMCAC's impact in Winona County, if people are watching at home.
Sure, absolutely.
They're able to follow. You can continue on, and maybe she'll call that up for us.
Okay. So some of our main office has been in Rushford since 1966, but we do have sites throughout the 11 counties. And here in Winona, we have our contact center and our clinic at the Hiawatha Valley Mental Health Building. We have senior dining sites in St. Charles and 2 in Winona. And we also have our Head Start sites here in Winona. Both are on Kramer Drive. One is within the Winona HRA building, and another one just this year opened up at Redeemer Lutheran Church. So that was a classroom that we had to move from St. Charles. New this program year, just due to low enrollment in St. Charles, but with a waiting list in Winona, we needed to go where the children and their families were. So that was a difficult decision to make, but an update this year.
I'm sorry, I didn't catch the first part. What did you move?
We moved the Head Start Center from St. Charles to Redeemer Lutheran Church in Winona.
Okay, because didn't you used to do something out at the homes on the?
That we continue to have those classrooms as well.
Oh, okay, so this is additional.
This is in addition, yeah, due to the waiting list that we had in Winona, it was able to
Okay,
service.
Thank you for that.
Yeah, of course. And any of the St. Charles families can also use our Rolling Hills Transit bus in order to get to the Head Start Center in Winona, so they can still receive the services of Head Start. So, yeah.
I'm not an expert on the move, but through my work at the high school in the community service learning class, I have students that volunteer, bless you. I have students that volunteer at Head Start, and I visited a couple weeks ago the Maplewood Head Start, but also for the first time, the Redeemer preschool. And the teacher said that actually 2 of the families actually moved from St. Charles to Winona just because of the availability of the Head Start program. So I know that ideally we'd have them closer to the people that need them, but it shows the importance of the availability of affordable preschool.
Great.
Thank you.
Yeah. So I can touch a little bit here on Head Start too, that as the impact report shows, there are about 66 children with both at the Head Start centers and through the home-based program that those children and their families receive services from Head Start. And so really it's that comprehensive service available for families that meet the federal poverty level guideline. So which is a very low number if you've seen the federal poverty guidelines. So that we're able to provide that service for these families, not just the preschool education, but also medical, dental services, connections to community resources, and just really a variety of services to impact the family. So we're able to continue that program. Also from our Hiawatha Valley Mental Health Center location, we have our family planning clinic that serves about 500 patients every year with affordable reproductive and sexual health services. And that's been in existence since the late 1970s that we've had a clinic here in Winona. So a really great service for people that regardless of income or access to insurance, that they can get that health care. Also at that location is our contact center. So that's where we have our outreach and emergency caseworkers that are able to provide homeless prevention services and crisis financial assistance and connect people to community resources. So last year, 40 individuals or from 20 households received crisis financial assistance for transportation, utilities, or a medical issue. And that's really made possible through a grant from the Winona Community Foundation. So I really appreciate the Community Foundation for what they're able to do and how they're able to help people in the county. We have that family homeless prevention program where 35 individuals from 14 households were served last fiscal year. Just in the last 12 months now, that number has doubled. And we've helped, well, about doubled. It's 24 households, but 69 individuals just in the last year. So we've received some additional state funds for that program. So that's one of the reasons why we're able to help more people, but also just that the demand has always been there, but now we're actually able to help. So, and we also we're able to do a car repair program with Winona County ARPA dollars that we received. Those funds were expended in April of 2024, so we are now done with that program in Winona County, but we were able to help 69 households with that program last fiscal year, and then an additional 7 before the funds were expended in this calendar year. So we very much appreciate those resources that we were able to help people with. We have an energy and housing department as well. And so through that we have energy assistance, that's utility assistance for people to get help with their winter heating bills. And that's available October through May. So the program is really gearing up right now. Applications are coming in now. Winona County has been the highest of all of our counties for households that receive that assistance. So last year it was 1,228. So it is a big number of people that are being impacted by that. The payments go directly to the utility vendors, and they can range anywhere depending on, and it does depend on the household size, their income, and their energy use on what that payment might be. So from that list of energy assistance recipients, we can see who may be eligible for the weatherization program. So we have a crew that can go out and weatherize homes to make them more energy efficient and to lower heating costs for low-income households. That weatherization, we have our own crew of workers that go out and do that work, but we also can do furnace replacement and mechanical system replacement using contractors. And so we do work with a number of contractors throughout Southeast Minnesota to help with that as well. We have housing rehab loans as well in Winona County that are available to help people with forgivable loan terms if they stay in the home for some bigger improvements that they may need, whether it's accessibility or just some quality and safety issues in their home. So that program is also available. Lastly, before I turn it over, because I do have one other speaker, Bill Spitzer, our transportation director, is here today. I also should introduce Kelly Dickey as our new planning and development director with SEMCAC. So excited to have her. She's in her first month with us, so very wonderful to have her. But so one last program I want to mention is our senior nutrition program. It is one of our largest programs and has a huge impact in Winona County. We have over 30,000 meals that are going out to about 300 people through our congregate dining sites as well as Meals on Wheels delivery. So that the congregate dining sites are in St. Charles and, like I said, 2 in Winona, but those Meals on Wheels are going out to Lewiston, Minnesota City, Rolling Stone, St. Charles, Stockton, Utica, Elba, and Goodview as well, and really all the rural areas between all of those communities. So really, if somebody is homebound, recovering from surgery or some other medical condition, they can be eligible to get that daily meal, and it's prepared by the kitchen here in Winona that goes in, so all of those meals are prepared out of the kitchen in Winona. One thing unique to the kitchen out of Winona is a newer program. It is our rural frozen meal program, and it really started, we got a blast freezer that can safely chill a meal within 2 hours to a frozen state so that it can retain its color and nutritional value. And then we're able to get those meals once a week with the help of our caravan van program, our transportation program, out to seniors that are in very rural areas. They're able to get a package of meals then and have them for the week. So it doesn't require daily transportation, which we can't do. It's helped us be able to serve a lot of hard-to-reach people. So very unique to Winona in this area. One
Are
thing.
those,
Yep.
so
Of course.
is there a sliding scale that some people pay for them and some don't? I mean, is there a sliding scale for
No,
Meals on Wheels?
the Meals on Wheels and senior dining program is donation-based program, so people are given the opportunity to donate towards the cost of the meal. But if they're over 60, it's up to them to determine if they want to donate to the cost of the meal.
Okay,
Yep.
okay, because I had elderly parents use that at one time, and yeah, it was great.
Yeah, so we do send donation letters to our clients, just letting them know, like, hey, you received this many meals this month, would you consider a contribution towards the cost? And sometimes we have family members that will contribute then because they really, really appreciate that service for their parent or aunt or uncle, so, yep. Yeah, and I will mention that 2025 will be the first year that we will be under a new intrastate funding formula from the Minnesota Board on Aging. So the state changed their funding formula where now more dollars are going to be directed to the metro area, and we're losing some funding. And so with rising food costs, we're looking at a $400,000 deficit for 2025 for our senior nutrition program across 400,000.
400,000 deficit?
Yes, yeah, that funding formula change was significant. So, and it's not just senior nutrition, it's all Older Americans Act dollars that are funneling down through the Minnesota Board on Aging. So we will.
They go to the school and get one of those free breakfasts?
Yeah.
I mean, seriously, they cut senior dining when we had an $18 billion surplus, and they cut senior dining for,
The formula changed, so the dollars
They
are
cut it.
still
You can say
going
they
to the
cut it.
state. The same amount of money is still going to the state, but yeah, just the way it's distributed across Minnesota has changed. So we are doing some legislative advocacy this year regarding that.
is that pointed out in here? I mean, we should contact our local,
I'd be glad to get you more information about that. I can certainly do that. Yeah, because we are looking then at what routes are we going to have to cut next year? In this, like the rural frozen meal program being one of the newer programs, that may be one of the first ones that has to go, just looking at how to maneuver through that deficit and how we're going to be able to be sustainable, but also looking for other private resources that might be out there and applying for lots of grants and yeah. So wanted to make you aware of that too, but I can provide more information to you in the coming week. I will get that to you.
please. I
So,
mean, I think
yep.
that's something we should really, that's insane to cut the old people off.
We're seeing it also in our volunteer driver program and our senior and caregiver advocacy program as well, because it's all those Older American Act funds that come from the federal government to the Minnesota Board on Aging, and then they're funneled down to the AAAs or the area agencies on aging, and then to the service providers. So when that funding formula changed, the area agencies on aging are all getting less, all in the greater Minnesota are getting less, so.
So what's the age that you considered old?
The Older Americans Act, the federal government says that that's 60 and over.
Oh my gosh, I'm old. I'm really old.
So I will,
Please give us that data so we can.
I will.
that, 'cause,
Yeah, I
you know, we
appreciate
will
your
have a
interest in that.
new, House of Representative in this area that we need to do a lot of educating.
Yes.
Okay, thank you.
Okay, of course. And I will turn it over to Bill so he can say a few words about SEMCAC transportation as well. But I'm around if you have any more questions of me. Yeah,
Thank you.
yes.
Hello, Bill. Thanks for coming.
Mr. Chair, members of the board,
Drive the van down? You didn't-
I did not drive the van down. I drove my truck, so. You should have some information in your packet. I also brought along a few of the hard copies if anybody needs those. Has all the information that you ever wanted about transportation, but were afraid to ask, so. Been in my role for about a year. And my other jobs have prepared me well for the position that I'm in. Some of you know my past there of working here for 31 years, actually 24 here, but 31 years in law enforcement. So one of the things I want to talk about is transportation. Transportation has always been near and dear to my heart. I'm going to start out with this little guide right here, the nice little colorful. So there's actually 34 different rural transits in the state of Minnesota, and Rolling Hills Transit represents one of those as part of SEMCAC Transportation. I'll flip right over to this little guy right here. This will actually show you our service area for Rolling Hills Transit, our public transit. A lot of times people, as I'm going around educating councils and county boards, didn't realize that we even had transit, public transit that's available in our area. So this kind of shows you exactly, where in the 5 county area that we operate buses. So we actually operate about, we operate 12 buses in over 20 communities that serve this service area. So within that service area, we operate these buses that are about 22 passengers. They're all handicap accessible. So everybody asks, well, who can ride these buses? We're trying to remove some of the stigma that was put on our system, and that only old people and kids ride our buses. But we have a new slogan, anybody can ride, and we're slowly increasing that awareness as we move forward. But like I did say, we do have a heavy percentage of our population is young people, whether it's early childhood or school-age kids that we transport to their facilities every morning and every afternoon. Then we also have a number of senior citizens or mobility challenged individuals that operate on our service. So just to give you an idea of what we provide for Winona County, we do have 2 buses that are stationed within Winona County. One operates out of St. Charles, and the other one operates out of Lewiston. So I'm working off the nice little infographic here that we have right here. This will show you exactly what our ridership is. So what I've provided you is the year-to-date for 2024. Currently in St. Charles, we've provided rides for 3,758 individuals. And if you look at the annual statistics right below it, you'll see that over the course of a year, we provide rides for just a little over 5,000 individuals in the St. Charles area. We operate a brand new bus out of St. Charles, and I'll talk a little bit more about the buses in just a second. So about 23,000 miles is what we put on those buses. On average, we have about 20 people ride per day on each one of those buses, and we operate.
Just St. Charles.
Just St. Charles, yep. 1,776 hours are put in by our drivers. If we flip over to Lewiston statistics are also provided. I did a year-to-date. We have 2,358 passengers that use that service in and around the Lewiston area, and about just a little shy of 3,000 passengers rode on the Lewiston bus. So these buses are slowly getting older and older, and we're currently in the process of renewing those. And I know Commissioner Ward had said that she had spotted one of our buses. So this is one of the new buses that we have online. So we operating this out of St. Charles. So that's one side and the other. And as you can see, we try to make it as noticeable as possible and make sure that people know that anybody can ride the service. It's strictly a dial-a-ride service. So how we operate, we do not have routes like Winona or some of the bigger communities. So I tell people it's just like a really big taxi cab. So individuals call a 1-800 number and they ask for a ride, and we will pick them right up at their doorstep and we will deliver right to them to their destination. Now, to try to make it more affordable, that's where the dispatcher has to earn their pay, and they try to get as many people on that bus as possible. So we ask the individual what time they have to be at their destination, and that's kind of what we base the ride on. So we try to get as many individuals as we possibly can on that bus during that time to make it the most cost effective. About the buses, so we are starting to replace those. 2014 is when we went online with our service as Rolling Hill Transit, and our buses are anywhere between 7 and 8 years old. So we're slowly rejuvenating that fleet. So these buses that you're seeing right here, they started out, we replaced 3 of them at $93,000. The second ones came in at about 132. The third one's about 141. And the one that I just placed an order for is $239,000. So it's just incredible amount of money that we are putting into these buses, these infrastructures. So as of the first of the year, we will have 9 of our fleet of 13 buses that we operate system-wide replaced. So that is very significant dollars. So you're probably wondering, where do you get all your money then, Bill, if you have to pay for those buses? Well, MnDOT provides funding about 95% of our operating budget. So 95% of our tax dollars are paying for our service. The other 5% comes from counties, communities that we serve, and also the fairs. The buses, however, are not on that 95.5. They are anywhere from 80% funded by the state, and then 20% we have to find those match dollars to replace those buses. So as you can imagine, as we slowly escalate to that $239,000 bus, it's going to be very, very difficult for us to come up with those local match dollars. We also, that's kind of our public transit side. If you have any questions about the public transit side of SEMCAC Transportation, I'd be happy to take those. Otherwise, I'll just move on to our other half of transportation and be as brief as possible.
Sure.
So the other half of transportation, we have the volunteer driver program, which you will notice in your snapshot that you received on Winona County. 7,001 rides were provided by volunteer drivers in Winona County. You by far are the leader in rides given in the 6 counties that we provide those rides to individuals. And those individuals are individuals that need to get to their medical appointment or some sort of appointments that they may have. We also operate what's called the Caravan. The Caravan is generally a STS service that provides individuals that may be mobility challenged, and we provide that service as well. Both of those services operate on insurance-based. We do have some rides that are provided just on a donation basis, and we generally have to go for grant dollars to help pay for those because, like I said, we operate that dispatch center, so we have to pay our dispatchers and such. So the one thing that I'm going to touch on is the volunteer driver program. As Jen had said, that's one of the things that's taking a hardest hit as well of our program, not $400,000 like senior dining, but nevertheless, we are also being cut as well in that program. So that's very challenging for us in transportation because we know that that's one of the things that your board is actually working on is how can you improve that transportation for all of the citizens of Winona County. So that is very important to us as well. So we want to make sure that we provide those services to individuals. So with that, any questions about transportation that we have? Otherwise, I have 2 stories that I'm end with.
Do you have any, those buses are very attractive, but I was driving, so I didn't pay real detail. Are you limited? Can you sell corporate advertising and stuff to them?
Bless your heart for asking that question, and it's in my little folder here, and I would be happy to give you that. So yes, we did start selling advertisement on the buses. In fact, we just closed a big deal in Casson on one of our new buses. So that is one of the ways that we're trying to get that local match, and that bank is actually paying almost the entire local match by advertising on our bus for a 2-year period. So yes, I'd be happy to send you some of those informations as well, because those new buses that come in are capable of having a full wrap, so to speak. So it's a moving billboard. So we're looking at creative ways to take care of that local match.
You missed out on the election cycle. You could have probably sold it.
I know, just a day late, dollar short, kind of the story of my life.
2 stories though you have.
Yeah.
Yes, the 2 stories. So one of the things that I always want to share is, and both of these are from public transit, and the reason that I'm using these is because these actually happened to me. So as soon as I ended my career with Winona County Sheriff's Office, I began driving for the bus. So I got to meet a lot of the passengers that we serve. And one of the things that I always consider very fortunate, and I'm sure most of you sitting in this room are very fortunate too, is you have a vehicle sitting in your garage and you can go anywhere, anytime, anywhere. And some of us even have two vehicles and maybe more. The individuals that we serve, 60% of them don't have driver's licenses for whatever reasons. Maybe they didn't get one, maybe they didn't, maybe they had it taken away, whatever that may be. So these individuals survive on our public transit and our volunteer driver program. So the two stories I'm gonna share is one out of St. Charles. So one of the individuals that I picked up, she was mobility challenged, and she was telling me about her trips to her appointments up in Mayo Clinic. She was paying $100 to get from St. Charles to her Mayo Clinic and then back home. Just to give you an example of what we would have charged her, or what we did charge her, is $12. So it's $6 per trip. So over there, $6 back home. For $12, she had the same ride, same attention to her detail. So this is a very important service that we provide for individuals that just don't have that capability for transportation. The second one is an individual out of Stewartville. And bless her heart, she loves her husband very well, or very much, and she always goes and has lunch with him. Unfortunately, she lost her license because she just didn't feel comfortable driving anymore, so she voluntarily gave up her license. So that took away all of her mobility. So she needed a way to get to her assisted living husband, where that's where he was staying. So every day we pick her up at about 10 o'clock, take her down to assisted living. She has lunch with her husband. They carry on conversation, and then we bring her back home. So without services like this, the volunteer driver program, without public transit, those rides aren't possible. So I appreciate your time, and I know I'm working with Maureen Holte a little bit about the volunteer driver program. One of the things that we really would love to get back in Winona County that we don't have is some assistance that we can provide medical assistant rides to individuals, because I know that number of 7,000 could go way higher than that, because we turn away a lot of individuals that we just can't serve because of that. So thank you.
Thank you for that.
All right. And the plus is they get a charming bus driver to carry on conversation with, probably, right?
Absolutely. We have great drivers and they love to talk, and they,
Yeah, you're probably a big part of their day. It's important. It is very important.
Thank you
exactly,
for what you do.
especially the kids.
Yeah, absolutely.
Okay,
Thank you very much.
thank you.
Is that it, Jen? And welcome, Kelly, thank you for your work with SEMCAC as well. Then is there anything else?
Well, it's a follow-up then. You'll provide us some of those things that have gotten cut, radically cut. And why do us out here in the, rural area get cut when the metro gets more? If you can provide any background there.
I will do
And
that.
If Bill's program is getting,
The volunteer driver program as
Yeah,
well. Yep,
yeah.
I will provide those details.
Thank you, Jen.
we need to advocate for those, for our citizens. Thank you.
All right, moving on to item 9.2, discuss / approve funding for local housing trust fund with 100% of SAHA funds received. Please start. And Chuck, you could speak from there, or you could also speak from your,
Yeah, you got
Yeah,
Mike.
you can sit.
Better up there.
that way,
Although that's a
Get up there.
position of power, that podium.
so that way we could also invite later on Buffy to come up
Buffy.
and speak.
Mr. Chair, Commissioners, so we're here to requesting that you approve funding the local housing trust fund with 100% of the state affordable housing aid funds received. Just to give you some background, and we've talked about this several times this year, but on September 10th of this year, the board adopted an ordinance establishing the local housing trust fund. In your packet is the materials in the ordinance that establish that. And I just want to mention too, Ms. Baranik is here, the executive director of the local housing redevelopment authority, SEMTRA. And so any questions that I can't answer, which are many, she's here to answer. But what we're here to ask you to do is to approve. We've already received several $100,000 from the second half of 2023, and we've received one half of the 24 payment with another one coming in December. So we're approaching $350,000 received from the state for affordable housing. And so what we're asking you to do is approve funding the local housing trust fund that we just established with the state affordable housing aid that we have. And there are other funding sources that Winona County is also providing for the local housing trust fund. The 2024 property tax levy has a piece, 45,000 that's set aside for this. And then in 2025, the preliminary levy, you approved 25,000 to be levied next year. So this is more or less up and running. Now we just need to approve moving the funds already received from the state to the local housing trust fund, which is a legitimate use and sort for those funds.
Ms. Baranik, do you want to address the board? You don't? Okay.
Uh, I-
Commissioner Meyer.
I'm fine with taking funds that have been received, but I would like the board to consider for maybe next year's funds, the 2025 funds. I've brought this up before. So this is from the website at the Department of Revenue that deals with SAHA funds. To the extent that any of the funds could be used to help with providers that we have contract with. I'm thinking here specifically of supportive housing. And I mean, housing with support for folks who have, let's say, mental illness issues. This is the thing that Hiawatha Valley Mental Health has. HCO does that same sort of work. But to the extent that any of the funds could be used to really assist the county in our mission of providing human services, that we think about maybe allocating some of the funds from next year towards that end. So all I'm really asking is that this says funds received. I'm just wanting us to consider that perhaps the funds that we are yet to receive in 2025, we might see if there's other uses that would actually help us with our mission of fulfilling health, human services.
Thank you. So this is informational for future discussion.
Yep.
Thank you.
Well,
Commissioner Ward.
yeah, so we've already obligated the 199, 327. And we're expecting these additionals, and you're asking us to do all of these to the housing fund? Is that how I'm reading this request, the
Yes.
background? But we can change, but didn't we put in here that each year we would have to decide if we would allocate these dollars? It's not an automatic?
That would be my preference, Commissioner Ward.
Yeah, that, if we're getting SAHA dollars, I can go along with the original.
Yep.
But every year we should have, in my opinion, we should determine if that's where we want it to go or if we want to do something different. Plus, SEMSHA is taking an administrative fee. Is that based on the total, is that a percentage, Buffy, or is that a flat fee? I don't remember.
You cannot take administrative fees using the SAHA dollars. So part of the SEMSHA levy that you approved
Was
is to
for-
pay for the administration of these dollars.
Was that the 20?
Nope, that is, the 25 will go into the housing trust fund to be used to fund the housing trust fund.
Do you recall the dollar amount? Was it
45,500
Yeah.
in 2024
Yeah, and
and
the
25,000 in 2025 as part of our preliminary.
portion for the administrative fee, it was like
15,
15.
Yeah.
yeah. $4,500 is for administering the housing trust fund.
Yep, 4,500, thank you, yeah, that's what I
Yep.
thought.
Yeah, okay.
All right, I think we could. Does that answer your question, Commissioner?
Well, yeah, so if we want to do each year and determine these SAHA dollars, what we want to use, this isn't written in here.
No, and what is in here is the document that creates the housing trust fund, so.
Right, so maybe we need to pass another different resolution to say we will, annually, we will
Yeah, I think
determine.
probably just how we word the
motion.
motion that we make for item 9.2.
Okay, because Ms. Bronick, the funds drop significantly, right?
Okay.
And it's questionable how long the state will do, these are
Correct.
state tax dollars.
These are
So
state
Ward, are you
dollars.
okay with the 2023 and the full amount of the 2024? which would be then 199,327 plus the 66,442.50.
Well, we haven't passed the local levy yet, so I can still, that comes in December, the actual, because we put dollars in that local tax levy for Sahat.
These are the state.
These are state dollars
Yeah,
that
state
you have a pot of money sitting at the county, 199,000 right now
Right.
in an account. You'll receive another 66,000 this year.
By the end of the year.
By the end of this year, and you'll receive another 57,000 next year. The question is where do you want to put those dollars? Your levy is separate, and
Right. But we put levy dollars into the
yes,
housing trust fund.
yes, you
also.
did.
Okay,
25,000
right, and we can still
and 45.
play with that, because we haven't, that isn't final.
Okay,
It's
so
preliminary.
if we did
Yeah.
the funds from 2023 and all the funds from 2024, it would be 265,752.50.
That doesn't take into account the December amount that we haven't received yet. You say you'd have to add 66,442 to it
There's another 66,442 coming? Ah,
this year.
okay. Besides what's listed in here.
No, that's not, no.
So
don't
I
think so.
added 199
And
and
the 66.
66,000.
And then add another 66,442, and that would complete 22 through 2024.
Could the motion perhaps talk, I think I know where you're going, maybe I'm wrong, is that to allocate all of the 2023 and 2024 dollars and 2025 will determine later?
That's what I'm suggesting. Commissioner Ward, are you okay with that?
Well, I'm confused now that you say, it doesn't.
I know,
say
it
we're
doesn't
getting
say
an
that in
extra
there.
66,000, I'm questioning that. So we're really giving them, you know.
Because I thought we got 132 last year,
Or 99, it says there.
Yeah, it says.
and it says 199, but
Is
so.
that enough?
Maybe we can, I mean, we don't really have to do this today, we could get clarity on this.
No,
Because
you know
you say
what?
expects to receive, the way I'm reading it, expects to receive an additional 66, it doesn't say $266,000 amount. I'm questioning that we're getting another 120 plus yet this year. It's already November, I mean. Are you clear on that?
I am not
Brown?
clear on what the county is
Because I
receiving.
thought it was
Um,
132,000 in '24 and 132,000 in '25.
And then it dropped.
Yes, that's right. And I guess I thought the 199 that's listed in here is
That's a different number
is
than we.
last year's plus half of this year's.
So maybe what we could do, or what you could do, just say, specify the years and the funds received.
Yeah.
And I'll do the math,
Yeah,
just
that's
double
fine.
check the math.
That's good to go.
Well, you can get by with it this year, but watch out next year.
I don't know. All right, so I would move that we go ahead and approve item, what's on 9.2, which is to allocate the 2023 and 19, and the 2024 amounts that of state affordable housing aid that the county receives to the Housing Trust Fund for Semtra.
Second.
Question. And maybe Attorney Sonneman needs to research this. What would it take to, if, everybody's into housing right now and they want affordable housing, but $200,000 isn't going to change the world. If this all goes, all falls apart, and how can we undo the Housing Trust Fund? Just by a motion to stop doing a Housing Trust Fund?
By the terms of ordinance. I think it's in there somewhere.
Yep.
Okay,
Yep,
so
it
we
is.
can,
Yeah, and I don't
Cease.
know in terms of if you've spent the money already. you have to spend it.
okay. Well, I guess, if the money's been spent, I don't have a problem. But if this isn't working, it's just not what we want to do, we can stop.
Yeah,
Yes.
I mean,
And we could
it's-
go a different direction.
It's listed. in-
Yeah, I thought it was, but it's hard to read all this quickly. Okay.
I'm just going to just review. So motion by Commissioner Meyer, seconded by Commissioner Olson. Any other discussion? So we will discuss 2025 at a later date. All in favor, say aye.
Aye.
Opposed, motion carries 4-0. Thank you, Ms. Brown.
Thanks.
That then takes us to item 9.3, which was added. 9.3 deals with the appointment of 2 commissioners to serve on the general election canvas board. For those of you who might be following, it's now the last page, 126. Thank you, Ms. Wilbright, for joining us.
Yes, so those that are on the ballot in November are ineligible, but then we need 2 commissioners to serve on the canvas board for certifying our November election. That meeting is set for 9 a.m. on November 13th.
So it cannot be Commissioner Olson or Commissioner Elsing.
Correct.
And the duties and responsibilities are just to review all the tabulations that your department does, and
Correct.
it's for all our presidential and House,
It's, we are certifying county and above.
county and above.
The cities and local municipalities, they will be certifying their own results. So, for example, City of Winona will be certifying the City of Winona seats. The school boards will be certifying the school board seats, et cetera. So we are certifying county and above races.
Okay, so the hotly contested soil and water, we
Yeah.
will be checking that one.
Yes. Yep, that's county and above.
Yeah, that's county and above. Okay. Well, I guess at this point in time, I think I'll be available November 13th. I can volunteer, if that's okay.
Commissioner Meyer, when you be available? I mean, I could do it, but I don't really have a conflict. I was a little bit of a conflict, but not fine either way.
I do have a meeting right at that time at 9 o'clock. And then that's the MICA board meeting, so I'll probably go to the
Oh.
cities for it.
Okay,
So
so if the board, the rest of
if
the
we do
board,
it, I'd be happy.
sure, absolutely.
Okay.
All right.
Because this should be, well, they're bigger elections, but
Yeah,
if the city and
should be.
school boards are taking care of their
Doing
own, yeah, okay.
Should
Yep.
be as, okay, all right. So do you
So-
want a motion or to just take volunteers?
I will move
Move.
to create the canvas board to meet on Wednesday, November 13th at 9 o'clock with County Commissioners Marshall Ward and Dwayne Bagley.
Second.
Motion by Commissioner Meyer, second by Commissioner Olson to have Commissioners Ward and Bagley serve on the general election canvas board. Any other discussion? All in favor, say aye.
Aye.
Opposed, motion carries 4-0. Thank you so much. Is there anything else, Chelsea?
I apologize that this was thrown on there yesterday, but we've had over the 10% of Winona County registered voters already vote and either turn in their absentee ballots or vote here in person.
And
We've had over 100 a day in the last few weeks. And even right from September 20th, we've had 50 plus a day. So my crew is working 10 plus hour days, and I apologize that this didn't get on the agenda earlier.
don't worry. Thank you for what you're doing. Because isn't the projection estimate that they think that 40% will vote early? You said 10% have voted. I mean, I think that's a nationwide estimate.
You're scaring me. We've already, so we had to throw out 2020 because everybody was
Yep.
locked up for COVID. So then we had 12,000 turn in absentee ballots, and we sent out around 14,000. So if we throw 2020 out as an outlier, we've already far exceeded 2016's numbers. We sent out about 3,200, if I'm recalling correctly, in 2016, and we've sent out about 4,700 already. We've already accepted close to 3,300, and total acceptance in 2016 was about between 28 and 2,900.
Okay.
So we've already exceeded 2016 by far, and there's still 2 weeks left, so.
Thank you for that. You and your staff too.
So there, you've sent out 4,700 absentee ballots.
Sent out or coming here. All early votes are counted as absentee.
And there are about 28,000 registered voters in the county, so.
We're at around, it always swells close to the big election, so I believe we're real close to 30,000, if not a little over at this point.
Okay.
Anything else?
Thank you. That takes us to agenda or consent for comments. Commissioner Ward.
Have those around to Commissioner Meyer. Well, yeah, they're two in them. Okay, we had our AMC district meeting. Maureen, I already gave Maureen copies of this. yesterday, and this is, AMC tried to create of what they do, particularly for Winona County. It's a nice capsule. Let's see, I got an extra one. A nice capsule of the funds and everything that they've succeeded. It's unfortunate AMC has to register as a lobbyist with the state of Minnesota. When you belong to NACO, the National Association of Counties, and go to the federal level, they aren't considered lobbyists, which seems kind of a strange thing. But it's the monies, and I did not get a chance to review if it's accurate or not, but I think I would like people to look it over and understand that AMC, it comes along with a dues increase. So they're trying to justify their work. But it is very critical. It's unfortunate that we do have to lobby our local legislators and get money to do all the things we do. And like you guys get cut $400,000. That's just ridiculous and stuff. And then we had, the second page is the potential legislative priorities. Everybody that was there got to vote, and they will be voting across the state of Minnesota. Then they will compile what they feel are the top issues in each of the general topic areas. And it's I have one of those too. I got those too. So always a good discussion about what's going on. All right. So if you got any questions on those things, please share or contact AMC staff.
Thanks.
Thank you. Ms. Solomon, I believe you had an item.
Yes, I do. I just wanted to, and I brought this cup on purpose.
Over, yeah. Homecoming,
Award.
Saturday.
No, it's homecoming.
Saturday.
They're playing Maryland, which.
Yeah,
went
I
as an
know.
undergrad.
You're a
But,
conflict of interest.
Yeah. I also was in the graduate program in the Department of Agriculture and Applied Economics, and I'm being honored as the outstanding alumni on Friday afternoon
Wonderful.
at the St. Paul campus. So
Congratulations.
share that. I'm very proud of that, but my whole family, I shouldn't say whole family, but quite a few of my family members have gone to the U, and it's really neat.
Wonderful.
Awesome.
Congratulations.
So if we
So, and then
if
I
we
brought-
show up, we get a free donut?
Can you just read the title, folks?
You can read, a profile and economic analysis of small farms in Minnesota, North Dakota, and Iowa. Comparisons between farm size and among participation in the US commodity programs. I did this on an IBM Selectric. And for my research, I had to use IBM punch cards.
Wow.
Yeah. Well, anyways, it's, yeah, so it's very, I'll share that great.
So you're
Project.
eligible for SEMCAC.
So we need you to update that report. And I was reminded the other day that we're all goo gaga over cover crops in the world of agriculture, but there is no monetary value to a cover crop. So we need to figure that into the economics.
My thesis, the findings are still the same, so
Okay.
it hasn't changed. Okay.
Do you have a 2-page summary you can share?
I
There'd be
won't read that.
an abstract, maybe?
An abstract. Actually, you can go online and find it. It's in the U of M library under my maiden name, Karen Leonard.
Oh, okay. If you had
Yeah.
a summary, I'd
I'll
be
send
interested.
you the link.
Send me the link
Okay.
in my spare time. I
Yeah,
can.
it's on the.
Okay, thank you. Well, congratulations for your honor.
I just want to add, if there is anybody who belongs to any kind of civic groups or other groups that might like to hear any kind of short presentation about the local option sales tax that'll be on the referendum, it's getting lost in all the noise about the presidential elections. But any of the commissioners and or maybe possibly staff might be able to go and talk with different groups about the local option sales tax, which will be on every county ballot on November 5th as well. I spoke to the Winona City Council last night, the school board last week. I and Commissioner Elsing were at the township officers meeting, et cetera. And so if anyone knows of any other groups that might be interested, we can keep it short. It's not the world's most scintillating presentation, but it's important.
Yes.
And it would be a help.
Just one thing, we just found out today that Friends of Winona Parks, a nonprofit that I co-chair with Howard Kruger, received a $10,000 donation. So we're going to be planting some trees in the Veterans Park in Winona.
Wonderful.
Great.
And all around.
Not ash trees, I bet.
No ash trees.
And don't park them so close to the road that they get damaged by snowplows and brush cutters and weed whackers,
All right, anything else?
please.
Motion to adjourn would be. in
So
order.
moved.
I'll second.
Motion by Commissioner Olson, seconded by Commissioner Ward to adjourn. Any other discussion? All in favor, say aye.
Aye.
Opposed? Motion adjourned. Thank you, everybody, for joining us tonight, and